A febrile seizure is a convulsion in a child that's caused by a fever. The fever is often from an infection, usually occurring between 6 months and 5 years of age. Febrile seizures are not considered a form of epilepsy. The majority of febrile seizures are simple febrile seizures, defined as generalized seizures lasting less than 15 minutes and not recurring during a 24-hour period. They recur in approximately 1/3 of children during early childhood. They are associated with a slight risk of future epilepsy. Complex febrile seizures are focal, prolonged, or multiple within the first 24 hours. They are associated with a higher risk of recurrence during early childhood and an increased likelihood of future epilepsy. Febrile seizures occur in approximately 2 to 4% of children younger than 5 years of age, and are the most common neurologic disorder of infants and young children. Pathogenesis is underlying genetic susceptibility with a vulnerability of the developing nervous system to the effects of fever. Risk factors are high fever, viral infection, recent immunization, and a family history of febrile seizures. The majority of children have febrile seizures on the first day of illness. There is usually a postictal phase that can be associated with confusion or drowsiness. It is crucial to rule out meningitis or encephalitis, which are the main concerns in a child presenting with fever and seizures. In children with a typical febrile seizure, there is no need for further diagnostic testing. Children with complex febrile seizures may need electroencephalography, EEG, and magnetic resonance imaging, MRI. Treatment is based on antipyretics for fever reduction and benzodiazepines for convulsion stopping. Children with febrile seizures are at risk for recurrent febrile seizures. Simple febrile seizures usually have no need for anti-seizure medication therapy. But some children with complex febrile seizures may need further prophylaxis anti-seizure therapy. As mentioned before, simple febrile seizure has only a slight risk for future epilepsy, but complex febrile seizures have an increased risk. Want to know more? Watch my channel.